The breast is made up of glands called lobules that can make milk and thin tubes called ducts that carry the milk from the lobules to the nipple. Breast tissue also contains fat and connective tissue, lymph nodes, and blood vessels. The most common type of breast cancer is ductal carcinoma, which begins in the cell of the ducts. Breast cancer can also begin in the cells of the lobules and in other tissues in the breast. Invasive breast cancer is breast cancer that has spread from where it began in the ducts or lobules to surrounding tissue. The most common symptom of breast cancer is a new lump or mass. A painless hard mass that has irregular edges is more likely to be cancerous, but breast cancers can be tender, soft, or rounded. Other possible symptoms of breast cancer include skin irritation or dimpling, breast or nipple pain, nipple retraction, nipple discharge. Sometimes a breast cancer can spread to lymph nodes under the arms or around the collarbone and cause a lump or swelling there, even before the original tumor in the breast tissue is large enough to be felt. Breast cancer is the top cancer in women both in the developed and in the developing world. It can occur in both men and women, but it's very rare in men. Each year, there are about 2,300 new cases of breast cancer in men and about 230,000 new cases in women. Several risk factors for breast cancer have been well documented. However, for the majority of women presenting with breast cancer, it's not possible to identify specific risk factors. A familial history of breast cancer increases the risk by a factor of 2 or 3. Some mutations, particularly in BRCA1, BRCA2, and P53, result in a very high risk for breast cancer. However, these mutations are rare and account for a small portion of the total breast cancer burden. Reproductive factors associated with prolonged exposure to endogenous estrogens, such as early menarche, late menopause, late age at first childbirth, are among the most important risk factors for breast cancer. Exogenous hormones also exert a higher risk for breast cancer. Oral contraceptive and hormone replacement therapy users are at higher risk than non-users. Breastfeeding has a protective effect. Some studies conclude that 21% of all breast cancer deaths worldwide are attributable to alcohol use, overweight and obesity, and physical inactivity. Control of specific modifiable breast cancer risk factors as well as effective integrated prevention of non-communicable diseases which promotes healthy diet, physical activity and control of alcohol intake, overweight and obesity could eventually have an impact in reducing the incidence of breast cancer in the long term. Although some risk reduction might be achieved with prevention, these strategies cannot eliminate the majority of breast cancers. Therefore, early detection in order to improve breast cancer outcome and survival remains the cornerstone of breast cancer control. There are two early detection methods. Early diagnosis or awareness of early signs and symptoms in symptomatic populations in order to facilitate diagnosis and early treatment. The second detection method would be screening, which is the systematic application of a screening test in a presumably asymptomatic population. It aims to identify individuals with an abnormality suggestive of cancer. A screening program is a far more complex undertaking than an early diagnosis program. Mammography screening is the only screening method that has proven to be effective. Raising general public awareness on the breast cancer problem and the mechanisms to control as well as advocating for appropriate policies and programs are key strategies of population-based breast cancer control. The prognosis, which is the chance of recovery, and treatment options depend on the stage of the cancer, which is the size of the tumor and whether it's in the breast only or has spread to lymph nodes or other places in the body, the type of breast cancer, how fast the tumor is growing, how likely the tumor is to recur, a woman's age, general health, and menopausal status, and whether the cancer has just been diagnosed or has recurred.